CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everybody. Welcome to the CURES Show, where we explore cutting-edge wellness from credible sources. And I'm really excited about this episode as we talk about natural and herbal medicine. Did you know that about a third of modern drugs come directly or indirectly from nature, and that more and more Americans are also turning to natural and plant-based medicine? So here in the studio to talk more about this is Whole Health Wellness Center founder and medical director, Dr. Jennifer Stagg, who is a naturopathic doctor, because we're going to dive in. I know so many people are really gravitating toward the idea of, can I take a supplement or could I try something more natural before I take a prescription medication? You're seeing that a lot more now.
Right, of course. I mean, as a naturopathic doctor, we of course attract people that come in with that mindset that they're sort of like prescribed a medicine, like a statin or an antidepressant or something, and they're kind of like, I don't know, like, is there another option here? I'm really not comfortable with taking that medicine. They're concerned about adverse effects, those sorts of things. So, but I would say definitely we're seeing even more patients that are not choosing to take medicine, right? That they may already be on one or two medicines that like they really do need, like a thyroid medicine or something, and they're just like, okay, that's it. I don't want to add anything else.
Whether it be that they are just have a personal desire not to have another pill, or the expense of it with health insurance, and some things aren't getting covered and all those types of things. So but I think what's interesting as we dive in, I first want to, we went into a little bit of your history on Great Day, Connecticut, and Scott was very funny about it, but I want to talk about, as being a naturopathic doctor, you actually were en route to just go to traditional medical school and then made a choice to go to naturopathic medical school. So you are naturopathic doctors go to medical school like a regular MD.
Absolutely. Yeah, exactly. And so, yes, like I was training, I was actually in a PhD program, very research driven. And ultimately, you know, I just discovered naturopathic medicine in our career planning center, like at the university where I was, University of Iowa. And I thought, wow, okay, the principles of this really align with what I do, like as a scientist, was like, okay, let's understand what the cause is, right? And, you know, I had some personal experience with family members in like medicine where they were sort of given that like Band-Aid approach of just like covering up things and not finding the true cause, and then finally seeing another provider who happened to be a medical doctor, a very good doctor, and found the cause and treated that. And it, like in this instance, it was surgery, but she was just being given like pain meds, right? And covering it up.
Well, that's what happened with the whole opioid crisis, right? I mean, so just as we get into where some of our drugs come from, or alternatives, because we're going to take a deep dive, and there's so many natural, it's very cool. I mean, the different supplements that are out there. However, the idea of a naturopathic doctor is a different philosophy in that you're trying to find the root cause. Like, just like when you're doing your lawn, you don't want to just pull the top of the weed, it grows back. You're trying to get to the root and fix it.
Right, exactly. So we're always really looking for more sort of like core issues that need to be addressed. And then sometimes we do need to use plant-based medicines to sort of like relieve some symptoms. Sometimes it's something acute, temporary. You know, in the last couple of years, we've seen a lot of issues with patients who are getting respiratory infections, and it progresses to a cough that won't go away, and they take antibiotics and they're put on prednisone and it's still not going away. And then we're using plant medicines, things like mullein, like just like really simple,
oregano
gentle,
oil by ADP. I'm taking it right now to avoid it.
And then those things are working, like they're working better. So that's another interesting thing that I don't have figured out yet, but it seems like people are responding better to plant medicines than ever before, because our bodies are like designed to really, you know, we have these receptors for these plants that are in nature.
Yeah, so 58% of adults used to do supplements before the pandemic. Now we're up to about 75% are doing supplements. And I know a lot of people say it's not regulated, they're just stealing your money, there's too much money going into the supplements. To a certain extent, that may be true. There may be some crappy supplements out there, and it's not regulated, but that doesn't mean that they're not safe. Often they can be a good first step and often safer than trying a prescription drug. Is that right?
Absolutely. Yeah. So certainly, yes. Like the criticism is that there's no like FDA regulation, right? So making sure you're buying from companies, and we've talked about this and you say it all the time, making sure you're buying from companies that are really testing their products and doing third-party testing, and you're getting a reliable product in that bottle is important, because people can come in and they've taken a plant and it comes from overseas, and it might, like, you know, there have been studies done on this, and it has rice powder in it, or like house plants, and it doesn't actually have the herb, and then they're like, oh, this didn't work for me, and we go, well, you probably didn't actually try the real plant. So then when we use the actual plant that we know that's actually identified as the plant, it works very well. And the whole issue is the safety level, right? So plant-based medicine has a much higher level of safety because it has so many different ingredients in there, all of these different compounds, and it balances out all the pathways instead of just pushing one pathway really hard like a synthetic or pharmaceutical medication will do, which will lead to side effects.
So also, a lot of the drugs that we're using today that could be, you know, game changers for people. There are sometimes, I know you'll say someone needs a prescription med. And so it doesn't, that's another thing about naturopathic doctors. It doesn't mean they all hate medicine.
Right,
it's just,
there's a time and place for it.
And you got to start with but there's other things that to just know that a lot of the drugs that we are taking come from plant medicine. So number one, red yeast rice is actually the precursor to statins?
Yes, exactly. So the first statin, which was called lovastatin, that's still available. It's considered like a low effectiveness statin, so a lot of people don't take it because it doesn't lower cholesterol as much as some of the other newer statins. But that was exactly extracted from red yeast rice. And red yeast rice is something that's been used in China for many years as a blood mover. It helps lower blood pressure. It's considered to be like heart healthy. It does lower cholesterol and supports the gut microbiome. So studies have been done on red yeast rice. So that's another thing, right? Like the criticism is there's no research on these products. And red yeast rice has actually been studied, double-blind, placebo-controlled trial. So that's kind of like the gold standard for research. 5,000 people, and they actually studied this in patients who were post-heart attack. So this is the same way they look at statins and say, like, you've got to get on a statin so we reduce your risk of having another heart attack or dying from, dying or having a non-fatal MI. And the research on red yeast rice is it actually lowers those risks even more so than statins.
Wow. Okay.
Which is like very powerful, and no one, or if you say you're taking red yeast rice, it's like,
but what's that?
That's like, not good. Like,
is it something that we eat? I don't even know what that is.
Yeah. So it's yeast. I mean, it's rice that's fermented with this particular type of like fungus, and it adds like this color to it. It's almost like purple red. And in China, it's used as sort of like a natural medicine. Sometimes they use it in food. Like things are different in Asia. They use a lot of different. Like, they use it a lot of this stuff as in like food and medicine and like funky tasting stuff, and they use that.
Well, I think it's also important to know that natural plant-based medicine has been around, right, for thousands of years, where the kind of medicine that you'll get when you go to your regular doc nowadays is maybe 100 years old? Like we're still kind of new at modern medicine.
Absolutely. Like statins as that example, that like first statin was isolated in 1979 and then like actually came to market in
I've been alive
the late
longer
80s.
than a statin.
Yeah, 1987, right?
And so let me ask you this. If you're on a statin right now, would you say that people could even explore, if they didn't like it, getting on to the red yeast rice, and you just take it? How do you take it? I think you brought some.
Yeah, so we do this all the time because we get patients that come in and they might have statin intolerance, like, they're having really terrible leg cramps, they're really tired on a statin, or some patients that are kind of like, I don't know, I might have a little bit of brain fog, I'm not sure, I'm considering going off a statin, is there another option? Now, we don't take patients off medicine. That would be something they should discuss with their doctor, but we can then offer them an option.
And this one?
Yeah, this one is what we've been using. So historically, we would use red yeast rice and often combine it with a plant sterol, which is just, like a kind of like a fibrous compound found in plants that makes it work a little bit better. This one goes a little further. This one came out a year and a half ago, and it does have red yeast rice in it. It also has plant sterols, but it has berberine and it has aged garlic in it. And this works so well to lower cholesterol. Like, I'll have patients that I put on this and their LDL cholesterol has went down 100 points.
Wow.
LDL, yeah.
That's the bad one, right?
That's the bad one. So not even like total cholesterol, like 100 points. And that is really, like.
And that's how many capsules a day would you take?
So the dosing, this was formulated by a cardiologist, actually. And the dosing could be up to 9 capsules a day, but I've never had to do that. 3 capsules, 4 capsules, 4 is the most I've had to have patients take so far.
Okay. So I also want to say that you're not going to find this at your local drugstore. Mm-hmm. And so that's another important thing, is that this is by a company, Biotics Research. It looks very medicinal. You sell that in your medical office. These types of supplements that you were seeing, these great results, they're tested. There's a lot of science behind them, and they're going to be different than the ones you're going to find at Costco or whatever.
Right, exactly. So this is what we call clinical grade, and so we're having medical professionals that are developing these formulas and using them in their clinics.
And how does one get those? I know they can go to Whole Health Wellness.
Well, yes, like obviously we have this, but Biotics you can buy directly from Biotics
online.
Yeah, online.
Okay. Same with another company I know you love, Metagenics.
Yeah.
And so this is also Biotics, and this looks like my oregano oil bottle, but it's not. But this is something that I just want to mention, the ADP Biotics, because we've talked about it before. It's not this one, but it looks like this.
Yeah.
And that's something where, our whole newsroom is using it now, because it really does get rid of the coughs. Or you start feeling like you're going to get sick, and you just pound, like you told me to take 6 of the oregano and a bunch of vitamin D.
Yep.
And sometimes the next day I'm like, I'm not sick anymore.
Right. Yeah. Amazing.
So it works almost like nature's antibiotic.
Yeah,
okay.
Absolutely.
So let's talk about willow bark. Scott was having fun with this on Great Day, that I have a headache, pass me the willow bark. But willow bark actually led to aspirin?
Yeah, exactly. So willow bark is something that has a very long history of use. It was used in Egypt. It was used by indigenous populations. They'd basically just like chew on that bark, and they used it for fever and pain relief. It was mentioned by Hippocrates. So this is has a history all over the world.
Okay.
And in the 1800s, the compound salicin was taken out of willow bark, and that's what became aspirin, acetylsalicylic acid. So through a chemistry step. So it's a little bit different, but it's derived.
Is that different from the stuff in the face wash, salicylic acid?
Yeah, well, it's like chemically similar.
Okay.
Yeah.
All right.
Acetylsalicylic acid, exactly. But it's aspirin. So when you have aspirin, like the concerns about aspirin is that it could cause gastritis, irritation of the stomach. It could increase bleeding risk. So this is another option that you can use that does have a very a lighter anti-clotting effect, which is through platelets. It's similar, like the same effect as aspirin, but it does have pain relieving ability, and it's anti-inflammatory. It's very nice, and it also has other compounds in it. Like we were talking about how plants have a lot of other compounds. It has these compounds, tannins, that protect the stomach so that it's not harsh on the stomach. But when you pull out one compound, that can make it harsh on the stomach because you don't have these other ones sort of buffering them.
Okay.
Yeah.
So for instance, if people want to, is that here or no? That's
so yeah, it's actually in
BioLA. So it doesn't say willow bark.
Yeah, it does. But so this has 3 different plants in it. It has willow bark, it has devil's claw, and it has boswellia, which is also known as frankincense.
Frankincense in here. Okay.
Yeah.
Take 2 capsules 2 times a day.
So we love this for stiffness, like osteoarthritis. This works really well as a joint anti-inflammatory and
what
pain
if you're
reliever.
taking, I don't know, something like that all the time? Like my mother-in-law will complain, my hands hurt, my knees hurt.
Right.
What if she's already taking something?
Right, so then they're taking something like ibuprofen, right, which has a lot of risks and side effects.
I just took 2 Advil this morning because I worked out and it really hurt, so I should have taken this instead. Does it work as well? Because when I need Advil, I need Advil.
This one works really nicely. This is a bit of an older formula that Biotics has had, and it works tremendously really well for,
Is that what
like,
you would do if you
achy
started to have
stiffness.
a headache?
So for a headache, yes, you can use that. A lot of times we'll use magnesium. There's also a rapid relief product by Metagenics that is like a really potent turmeric that gets into your system really quickly.
Wow.
And it's an excellent sort of like swap out for ibuprofen. So there are a lot of options.
Okay.
Yeah.
Okay. So, everyone has their differences. Like if you think, like I always said I don't have a problem with Advil as long as I'm not taking it all the time. But some people really can't take it or, there's a lot. Let's just jump into that right now.
Yeah.
A lot of people are scared about Tylenol right
Yeah.
now. There's been some links to autism. I know that's controversial, but can I ask you a little bit about that and would taking something like this help a pregnant mom?
So I mean, exactly. So now with herbs, a lot of these herbs have not been studied in pregnancy. So
Okay.
we're really cautious about what we recommend during pregnancy. So I wouldn't use something like this in pregnancy.
Okay.
Just because it hasn't been clinically studied. With Tylenol, though, I mean, there are legit concerns or side effects and liver toxicity. Like there's tremendous amounts of data on that. So it isn't something that we should just be like popping
Okay.
like people do. We're very reliant as a society on
Pain
using
relievers.
pain relievers, and there are a lot of great options for non-pregnant individuals.
Okay,
right?
okay.
Yeah.
Right, okay. So we have to be, you want people to be careful, even with we think over-the-counter medication, can't hurt me, it's fine, it's over-the-counter, I can do whatever.
Yeah.
And that's not necessarily true.
No, absolutely. And you can get, so I mean, with Tylenol, the main issue is with liver function, which
Okay.
there's many cases per year of liver damage. And if an herbal supplement ever comes out, there's any question of toxicity to the liver, it's all over the media. And then it's discounted, something like Tylenol. And you can look at the statistics, like there are 100,000 adverse effects reported from
Even if you take it as directed?
NSAIDs yearly, yeah.
Okay.
Yes.
All right, so we've talked about willow bark leading to aspirin. And okay, so if you're curious, Biotics Research BioLA could be your natural aspirin, I guess. Also, poppy, and I feel like more people know about this. Poppy seeds, that led to morphine and opioids. People used to joke if you have a poppy seed bagel, it's kind of like getting high. And of course it's not. But
Right,
the
exactly.
poppy seed, did it also lead to heroin? Or
Yeah,
Okay.
yes, exactly. So first it was morphine. So it was like the latex of the poppy flower that was primarily used. And like that was used by doctors and pharmacists. They were actually using poppy for pain relief. And a lot of people didn't have surgery, but if they did, like it was kind of like a really last resort option. And then they were using poppy. Then they figured out how to pull a compound out of poppy, which like codeine, morphine, those are compounds that are found in poppy. Now, poppy is something that is, we don't use that any longer because it is, toxic, high risk, right? So it's
Okay.
not something that we use because we have other pain relievers. But then so it was all done orally. And then in 1850, around that time, they started using it through like hypodermic needles.
Okay.
And this is when like the addiction really started up. And then they thought, oh, well, we'll make heroin and that'll be less addictive. And that was around 1900s. And then they started trying to make these other forms, trying to deal with this addictive aspect of it. And obviously we did not do so well with that.
we didn't do so well.
Yeah.
Okay. Let me just, this is maybe a dumb question, but can people get addicted to just poppy seeds?
No, not
No.
poppy seeds.
Or
yeah,
like
because in the
poppy,
seed
it-
itself, there's nothing. Yeah.
Yeah,
It's
it's
more
ju-
like in the latex of like
That what they
the
strip out of
seed.
it to make
Yeah.
it a medicine?
Yeah.
Okay. So most of the time, if you're just having food,
Oh,
can
yeah, you
definitely be
eat,
medicine.
Like,
But
poppy
when,
seeds is fine.
I had a doctor once tell me, well, come on, that's not going to work. If any of this stuff worked, we'd all just drink tea.
Mm-hmm.
Your response to that would be that when we're just drinking tea, or even if we're just eating in food, not that can't be important.
Yeah.
But this is all this stuff on the table. The supplements, at least the ones that you have in your office and that you recommend, are much more potent.
Right, exactly. And we can use it in capsule form. Sometimes teas can work very well. It depends on the potency and how much of that herb you're putting in there. We also use it in liquids like tinctures too, and that can be another effective way of getting that plant in.
Okay. I want to take a moment and hear from one of our sponsors, and then we'll talk about some more natural remedies that are actually known to perform better than drugs, even one of them that has outperformed one of the most common drugs that a lot of people are on, which is metformin. But let's listen to this first.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit WheelerHealth.org to learn more and take the first step towards recovery today.
All right, we're back now with Dr. Stagg, and we are talking about the roots of many prescription drugs and plant medicine and herbal medicines. And Dr. Stagg is a local naturopath here in Connecticut, but sees people from all over the world. And you also have a new show on YouTube, The Natural Doctors.
Yes.
Okay, with Nutmeg TV.
Right, exactly. So we just started that up. We're in, I think, episode 6 is getting ready to air this week. And this is our topic, is talking about plants that came, or pharmaceuticals that came from nature.
Yeah.
Yeah.
So we can follow you on Instagram. It's at Dr.
Jen Stagg.
Jen Stagg.
Yeah.
Okay, so you'll find her and talk about. So berberine, we've talked about it on CURES before. I take it, full disclosure. It was something you recommended to me. You know, I was saying I don't really want to do a GLP-1, but I want to help my insulin sensitivity and I want to lose some weight. And full disclosure, I can tell a difference right now because I just moved a couple weeks ago and I ran out of supplements and I just haven't gotten them. But the berberine, when I was taking it, I do notice a difference that I don't have as many swings and cravings. And this is something we use for blood sugar and weight management.
Yep, exactly. So berberine is something that another one of these supplements that has a long history of use, and we've used it for pre-diabetics and non-insulin dependent diabetics for many years. And there are a lot of studies that have really looked at the effectiveness of berberine and milligram per milligram. So you can take 500 milligrams of berberine and it equates the effective level of metformin. Metformin itself was derived from a plant, not berberine, something a little bit different called goat's rue, but that plant is a little bit too toxic that we don't use it that much. But that metformin actually came from nature as well. It was derived from a compound in a plant. Berberine is safer, though, than metformin. So it does not deplete some of the things we run into. And metformin as a medication is not like a really toxic medication, as you know, in
Metformin is given
to a lot
if you're like early stage diabetes or pre-diabetes.
Like you'll see it for pre-diabetes and like early stage diabetes, and it will lower blood glucose levels. It can also deplete B12 levels, though, and it can result in some alterations in the microbiome that are a little bit more extreme. Now, some of the effect of metformin does happen through the microbiome. The same thing with berberine, that our gut bacteria has a role, just like GLP-1, that actually comes from like byproducts of gut bacteria.
All the weight loss drugs that people are taking
exactly,
now. So.
Like Ozempic and the peptides. But berberine does have that effect. Metformin, though, is a little bit stronger, so it has some side effects, and it does relatively commonly we'll see patients that are coming in that are on metformin and they're not tolerating it because of those GI side effects, because it is affecting your microbiome a little too strongly, and some people are a little more sensitive to that, so they're having diarrhea, like they're not doing well on it, and they're looking for an option. And berberine is an excellent option that also lowers cholesterol. It's really good for fatty liver, so a lot of those metabolic patients do have multiple different issues that berberine can help with.
Yeah, and there's so many women in midlife. I just hosted this menopause symposium. I know you and I have talked about this. That, are like, gosh, my metabolism is changing, which happens. And maybe you never had to worry about your weight before. And now you're noticing that they're like the littlest bit of carbs or something, you're gaining weight. Yep. A lot of that can be heading toward prediabetes or blood sugar problems. So something like berberine, they call it nature's Ozempic. Is that a fair term?
Yeah, in a couple of different ways. So it does help with insulin sensitivity really well. And that's mostly, like, a lot of times women in perimenopause are losing some of that insulin sensitivity, which is a precursor to prediabetes and diabetes. And that one we've talked about before. A lot of doctors don't test for that, right? So a lot of people don't know they have these high insulin levels. So berberine can definitely help with that. The other thing that it does is it helps quell that food noise, like that's all, the trend.
Yeah, you're not as hungry. Like you eat it,
yeah.
eat it, which, I don't even know if I have a ton of food noise, but I definitely will get cravings. I have known friends who've done the GLP-1s, and they said that was the game changer, is like they just aren't thinking about food all the time. I know Oprah said that. She's like, I finally know how thin people stay thin, they're not thinking about food all the time.
Yeah.
So I guess there are some people that are always thinking about
Yes.
food, and so then they need something to quiet the food noise. And
Yeah,
so
and
berberine can help.
berberine is certainly, it's not Ozempic level, right? But for someone who has milder version of that, it can help with the food noise. And maybe next time when we're here, we'll talk about a new product that's coming out that we're starting to experiment with in our
I
clinic.
want to hear it. You're testing. I think that's so interesting. So when these new products come out that are formulated by the companies that you trust, and if you go to someone like you do prescribe them. I should say they're not covered by insurance.
Right.
You're not going to go to CVS and pick them up, but you tell people exactly how to take them.
Yes.
And you try them on yourself. Usually, you want to make sure that you know what the side effects are or how they're working,
and how it feels in your body, right? So a lot of times I'll take things, and I might not even have anything going on, and I just take these things
so that you know
I know what potential side effects could be.
Okay, so St. John's wort, in our last couple minutes, I know you can't take this if you're already on an SSRI, but because St. John's wort was actually sort of the precursor to SSRIs?
Yeah, well, so it works a little bit differently. SSRIs, I would say this is more of an example of a medicine that works just as well as an SSRI.
Oh, okay.
So this specifically, St. John's wort, has been shown to be just as effective as SSRIs for mild to moderate depression. Now, here's another example of a plant that in the media got this bad reputation that it didn't work. There was a clinical study that was done and published comparing St. John's wort to Prozac at the time, and it said, oh, St. John's wort doesn't work. So in this study, it didn't work for severe depression. What they left out was that Prozac didn't work for severe depression either. So the headline that was picked up was St. John's wort doesn't work. It does work for mild to moderate depression, right?
Okay.
And that's what Prozac works for. And it works just as well. So there's been a meta-analysis of I think there's 15 or 20 studies done now showing the effectiveness for St. John's wort. It does help with serotonin. So when we talk about SSRIs, we're talking about serotonin specifically. Yeah. So those medicines really target that one pathway, just serotonin. And St. John's wort, on the other hand, because it has so many different compounds in there, it targets serotonin, it targets dopamine, it targets norepinephrine. So it has more broad-reaching effects, and it also comes without, the side effects that can happen with SSRIs, sexual side effects, weight gain, those sorts of things.
Emotional blunting.
Emotional blunting is a big one.
And some people say the SSRIs don't work as well. So would you, okay, so we only have a minute left. But basically, if you're thinking about trying an herb, do you just try it? Do you need to go to your naturopath? How do you know the right way to take it?
Right. It depends on the circumstances, right? So obviously, when people are already on medications, there are certain contraindications with, plants and medicines, just like there are with medicines and medicines. So that makes you a little bit more complex. So if you're someone who's on medicine, you really should probably see a knowledgeable healthcare provider to really decide what's right for you.
Well, I want to let you know that you can follow Dr. Jen Stagg. I know you also have people that you can make appointments at her clinic, and you can watch her show, The Natural Doctors, on YouTube. So learn a lot, see the kind of herbal medicines that she's having success with, and so many people are curious about this. So thank you for coming on and talking about really the roots, pun intended, of prescription medicine.
Absolutely. Thanks so much.
Thanks, Dr. Stagg. Thanks for being here for CURES. You can listen on any podcast and always streaming on WFSB Plus for free and the Wax. See you.
CURES, sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.